Please be seated. Thank you. Well, good afternoon, everyone, and thank you for joining us here today. This is the HHS briefing on the China coronavirus, and we aim to do two things today. Provide the American public with an update on the risk presented by the virus and provide the latest update on the actions that President Trump's administration is taking to respond to the outbreak and keep Americans safe. I'm joined today by Dr. Anne Schuchat, the Principal Deputy Director of the Centers for Disease Control and Prevention in Atlanta, Dr. Tony Fauci of the National Institute of Allergy and Infectious Disease, Dr. Robert Kadlec, HHS's Assistant Secretary for Preparedness and Response, and Dr. Stephen Hahn, the Commissioner of Food and Drugs. As of this morning, we still have only 14 cases of the China coronavirus detected here in the United States, involving travel to China or close contacts with those travelers. We have 3 cases among Americans repatriated from Wuhan, and we have 40 cases among American passengers repatriated from the Diamond Princess in Japan. I want to thank the responders and communities that have worked with HHS and the administration to provide these Americans with the treatment they need. I'm also grateful to the governors and other state and local leaders who have worked with us in close partnership so far. The immediate risk to the general American public remains low. But as we have warned, that has the potential to change quickly. There is now community transmission in a number of countries, including outside of Asia. That's deeply concerning, and community spread in other countries will make successful containment at our borders harder and harder. That's why we've already been working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, because we will likely see more cases here, as we have said throughout this episode. Dr. Schuchat will provide some more details on what that will look like, including how we would treat potential cases that arise from community transmission here in the United States. This preparation has been possible in part because of how aggressively President Trump has responded to this outbreak. As soon as we knew of the threat presented by this novel virus, public health leaders were monitoring it and beginning to prepare. The travel restrictions that the president put in place at the beginning of this month have given our country valuable time to continue to prepare, and that is precisely what those measures were designed to do. That includes working with Congress. Yesterday, the White House sent a request to Congress to make at least $2.5 billion in funding available for preparedness and response. There are 5 major priorities within the supplemental request, which I underscored this morning before the Senate Appropriations Committee. First, we need to expand our surveillance work, building on an existing system we have within CDC's influenza surveillance network. Second, we will need funds to support public health preparedness and response for state and local governments for what could be a very large-scale response. We don't know, but we must prepare for that just in case. This support complements the significant funds that these partners have received from CDC for preparedness, about 2/3 of $1 billion a year in recent years. Third and fourth, we need to support the development of therapeutics and the development of vaccines. Given the scale of this outbreak, the private sector sees a real market for both kinds of countermeasures, as well as for diagnostics, but federal funding and guidance can accelerate this work. Dr. Fauci will address the current status of that work in more depth. Fifth and finally, we need funds for the purchase of personal protective equipment for the Strategic National Stockpile, a topic that Dr. Kadlec can address. I'll conclude by noting that though scheduling conflicts prevented this briefing from including other members of the President's Coronavirus Task Force, we'll be providing a new update from interagency leaders soon, and we expect to continue doing so regularly. Earlier this afternoon on CNBC, the National Economic Council Director Larry Kudlow offered an update on how we see this outbreak affecting the economy. This morning, Dr. Messonnier from CDC provided the usual telebriefing. As Dr. Schuchat will emphasize in just a moment, the Trump administration will continue to be aggressively transparent as the outbreak and our response evolve. We'll continue keeping the American people and the media apprised of the situation, as well as what everyone can do to prepare. In the meantime, I'll continue to work closely with President Trump and the President's task force on our preparations to keep Americans safe. With that, I'll hand things over to Dr. Schuchat for an update from the CDC. Dr. Schuchat?
Well, thanks so much. I'd like to start out by saying it's a difficult and uncertain time. We, along with our partners around the country and around the world, have been confronting a dynamic, rapidly evolving situation. I'd like to let Americans know that CDC and our nation's public health agencies are preparing every day for this type of situation. Preparedness started long before this outbreak. The U.S. government's response to the spread of the novel coronavirus into our country began as soon as reports of an unidentified flu-like illness emerged from Wuhan, China. The U.S. has been implementing an aggressive containment strategy that requires detecting, tracking, and isolating all cases as much as possible and preventing more introductions of disease, notably at ports of entry. We've restricted travel into the U.S. and have issued multiple travel advisories for countries currently experiencing community spread. Our travel notices are changing almost daily as we get new information, and we believe these precautions are working. So far, as Secretary Azar described, our public health system has detected 14 cases in travelers or very close contacts of travelers here in the United States. Among passengers repatriated by the State Department from Wuhan, China, and from the Diamond Princess, there are an additional 3 and 40 cases. The fact that we have been able to keep cases to this low level is an accomplishment, especially given that we are unfortunately beginning to see community spread in a growing number of other countries. Based on what we know right now, we believe the immediate risk here in the United States remains low, and we're working hard to keep that risk low. But we must use this time to continue to prepare for the event of community transmission in the United States. Part of that preparation is educating the public and our state, local, and private sector partners about what transition from aggressive containment measures to community measures or community mitigation would look like should we end up there. Under our current aggressive containment posture, patients infected with the coronavirus who have mild or no symptoms are being placed in healthcare facilities for very close observation and isolation. That intensive level of medical care is not typically needed. As we've watched these cases and learned over the past several weeks, we realize that other approaches to management are likely fine. Outside this period of aggressive containment, the usual and appropriate care for most patients who develop the novel coronavirus or COVID-19 would be management at home through home isolation, with use of healthcare facilities only as needed for those who have severe presentations, the elderly, those with medical conditions requiring closer observation. We will maintain for as long as practical a dual approach where we continue these measures of aggressive containment to this disease, but also employ strategies to minimize the impact on our communities. However, current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus. What these interventions would look like at the community level will vary depending on local conditions and on the emerging information about how severe the virus may be. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease. We have been preparing to address this type of threat and limit the impact on our communities for many years. As some of you heard from Dr. Messonnier of the CDC today, we've begun laying out for the public what it will look like to mitigate the spread of the virus. There are obvious common sense tools like good hygiene, social distancing, things like staying home when you're sick, things we talk about during a difficult flu season, or things that we talked about during the 2009 H1N1 pandemic. We will be transparent with the public about these measures and the potential that these tools will be necessary. There is literally a playbook for the use of these tools, and one that the states and local public health have exercised. We are committed at the CDC and across HHS and the US government to radical transparency, to making sure we're sharing what we know when we know it, and we're giving you a sense of what the future may hold. I'd like to now turn things over to Dr. Fauci for his update.